Luckily, fillers are dissolvable. We can get rid of them. So if you have a lump or a bump or even fillers from another place, we can talk about dissolving those fillers and fixing it so that it looks the way you like it. Hi everyone, it's Dr. Ellern here at Reflections. I'm a cosmetic physician, and today we are talking about the aftercare for lip fillers. So many people love to get their lips filled. It is a super popular treatment that we do here at Reflections. We do many lip treatments per week. And so many people want to know, okay, so we got our lips done, they look great. What do I need to do to manage them immediately afterwards and also to maintain the effect? So we do the lip fillers. You immediately are going to have a little bit of swelling. So we always tell people ice on and off as needed to deal with the swelling. We ask that you sleep with the head of your bed elevated after you get home. That will help kind of allow any swelling to go downwards. Sleeping with your face smushed on a pillow or doing anything where you're face down or more flat will increase the amount of swelling that you have in your lips. The next morning is going to be the worst in terms of the swelling. So just anticipate that. You want to most importantly plan ahead so that it's not a big event or something the first couple days after you have the fillers. Most people's swelling will kind of taper off after that point, and by 2 weeks should have pretty much absolutely nothing in terms of bruising or swelling left. In terms of bruising is possible at any time we stick a needle on somebody. It's just a matter of fact that can happen. If you happen to get a bruise, we have a laser called Bruising that we can use to help break up and move the bruise along a little more readily. Some people swear by using arnica. That can also help with any bruising. We also ask that prior to treating, to try and minimize your chance of getting a bruise, that we are just conscious of fish oils or aspirin or Advil use or anything that can kind of thin your blood, make you more prone to it. In terms of just maintaining the look that you've now achieved, we have people come in periodically to refresh their fillers. The traditional lip fillers that we're using are usually lasting around 9 to 12 months. And we have many different products we use, and it's kind of injector dependent, both technique-wise as well as product-wise. But that's on average what it is. So most people are coming in every 6 to 12 months just to kind of refresh the fillers that are in place there. A lot of questions about what can I put on my lips, because you're very excited and you have all these nice plump lips and you want to show them off. Immediately after we do it, there's needle stick holes. We don't want to put anything that is going to get bacteria into these holes. Sometimes we'll apply a little Aquaphor over it or something like that. We don't want anyone putting makeup on at least till the next day. Let the holes have a chance to close. This is a semi-permanent substance. We don't want to get any bacteria inside with it because then we'd have to dissolve it and deal with that. So just no makeup of any sort anywhere we stuck the needle in. Otherwise, after that, you can start using your makeup as planned, and sometimes that will help with hiding any little bit of bruising if you have a small bruise as well, if you put a little lipstick on. A lot of people have questions about whether they can kiss or use their mouth afterwards. There should really be no issues when you're numb. If we do a nerve block or you have some numbing cream on and you can't feel as well immediately afterwards, just be conscious not to, chew or bite on your lips. You don't want to be really handling them, massaging them. If you happen to get a little lump, you can massage it, but just be conscious, especially while you're numb. Just be careful. Kissing wise, I would just be careful putting anything where you're going to have an exchange of bacteria, not like be licking your lips or anything immediately afterwards. Just to minimize that. But by the next day, you should be fine to pretty much resume anything you're comfortable with and that sort of thing. Now, one thing we just want to be conscious of anytime we're doing procedure is any sort of complications. Like we talked about bruising and swelling, those are things that are known to happen. We want to be cognizant to pay attention that you're not getting any whiteness, mottling, meaning kind of blue or almost like when your hands get cold kind of appearance. That could be a concern for an occlusion, and we just want to be conscious that if anything like that were to happen, that we call and immediately come back in so that can be dealt with. That's a risk with any filler, but just be conscious that that is something we need to think about. In terms of what fillers we use, many people are really excited about Restylane Kiss. Restylane Kiss is the newest, greatest thing on the market. Really amazing product. We also frequently use Juvederm, Restylane, and there's a few other ones too, but those are probably our primary 3 that are getting used for lips. It depends on the person and the age of the lips and the need for structure as to what we use. So we will kind of talk you through the technique and the product, which is somewhat treating physician dependent, what you need. Okay, so if you have questions about any of this, you feel free to come in. We can kind of go over the plan with you and come up with something that's going to work for you to get the results that you're looking for.